Africa Prime, brought to you by Jamison Select Reserve.
Hello and welcome to Africa Prime. I'm Larry Medowo. Many studies of the economic impact of AIDS in Africa have concluded that the macroeconomic impacts of HIV/AIDS could be significant, and that is chiefly because, unlike other diseases, it strikes people in the most productive age groups. And with us now is the chief HIV/AIDS fighter for Africa's business community as a whole. She's Dr. Valentine Douala-Mouteng, CEO of the Pan-African Business Coalition on HIV/AIDS and Health. Many thanks for coming on the program.
Thank you, Mr.
You
Larry.
have a CV that anybody could envy. You're a medical doctor, you're a specialist, you're a pediatrician with public health and epidemiology research background, 15 years worth of work. Give us, what have you been up to in the sense of, give us your background?
As you said it, I'm a pediatrician, and I've been working as a pediatrician in Cameroon. I was a civil servant. Then I joined the United Nations Population Fund's office in Cameroon because it was very important to embrace public health. As a pediatrician, you take care of one child at a time, and public health gives you the opportunity to increase the impact of what you could do. And then I moved to the ILO, International Labour Organization Sub-Regional Office in Yaoundé, where I was in charge of the HIV/AIDS workplace program. And we were working at political level, at national level, with the companies, and we are also targeting the workers. And from there, I've been very aware of the need of tackling AIDS among the workers and targeting particularly the workers. As you said it, 1 out of 10 people living with HIV are workers or people who are going to work.
So 10% of the workforce.
It's nine out of 10 people living with HIV are workers.
Yes. People
in their productive age. So the HIV, the studies performed in 2003, 2004 have shown the negative effect of HIV on the workforce. And yes?
You're very passionate about this. Is it when you were practicing as a pediatrician that you started feeling the effects of HIV/AIDS were having in communities down in Cameroon?
When I was working as a pediatrician, I had the first cases of AIDS among the children.
Right.
But it was really when I joined the International Labour Organization that I was aware of the need of tackling particularly the workers. And because these people, they need to be educated, informed, and they need to have access to the treatment. Because those workers, they are educated,
right.
they have experience, they are skilled, and when they are sick, there is a loss in productivity for the company, loss due to the absenteeism, and when they die, there is a loss for them, their families, their communities, for the companies, because sometimes it's very difficult to replace some expertise.
Right.
And in Africa, we are already lacking some expertise.
And also it is in Africa where perhaps the greatest impact of HIV/AIDS is than anywhere else in the world.
Exactly, 70%. It is said to be bared by Africa, 70% of a burden.
So how did the Pan-African Business Coalition on HIV/AIDS coalesce and form to become what it is today?
The Pan-African Business Coalition was created to fulfill the need of a coordinating body for the National Business Coalition. I must say that because of the negative impact of HIV in the businesses, in the enterprises, the need of creating National Business Coalition was felt, and the World Bank and UNAIDS had that initiative of creating national business coalitions in countries. So those bodies, they emanate from the private sector in the countries, from the employers' organizations, trade unions, chamber of commerce, and their role is to provide technical assistance to the private sector, to the companies, to design and implement HIV/AIDS workplace program. So now the Pan-African Business Coalition was launched in 2008, and it is, I must say, operating actively since June 2010. And our role is to provide capacity building to the National Business Coalition so they can better serve their company members.
Let me step in here, because capacity building is a phrase that is very commonly used by civil society organizations and organizations like yourself. But what does it mean in your case exactly when you say your capacity building for national organizations related to HIV/AIDS?
I would like to share what we did, for instance, in 2010.
Right.
After a needs assessment, we organized 3 workshops to improve the capacity of the Business Coalition in program management, for instance. But there is also something else regarding particularly the programs. There are missed opportunities in the workplace regarding, I will give the example of the prevention of mother-to-child transmission of HIV.
Right.
This must be highlighted or increased in the workplace program. And also TB control. Many companies are implementing HIV/AIDS program, but tuberculosis is linked to HIV, and fewer companies are implementing or are integrating tuberculosis in their program. This is the kind of things we're doing with the National Business Coalition.
So in which countries exactly do you operate in?
I'm operating from here because our office is based in Johannesburg.
Right.
But our members are the National Business Coalition in 30 countries in sub-Saharan Africa, spanning Francophone, Anglophone countries, region, and Mozambique.
You have had a lot of involvement in trying to bring on actively the Francophone part of Africa into the Pan-African Business Coalition.
Yes. And it is very important for us to bring together the Francophone and Anglophone countries because we are facing the same challenges. And some countries have started the fight earlier before other countries, and
yes,
they have some experience and tools, materials they are using that could be used, that could be shared with the other countries. That's why it's very important to bring together all the National Business Coalition to share what is done, to share experiences, and to learn from the best of the good practices from others. This is what we're doing. And for instance, now we have some members in Senegal, Côte d'Ivoire, Burkina Faso, Niger, Benin, Cameroon, DRC. Yes, this is regarding the Francophone countries. But I must say that in those countries, people are dying more from malaria than from HIV.
Right.
That's why the Pan-African Business Coalition is focusing on HIV, tuberculosis, and malaria. Because malaria also has a negative impact on the businesses, in the productivity of the business.
And you're saying it is a bigger problem in many of those countries than even HIV.
Exactly.
How do you get the funding to do all these activities you do? How is the even governance of the organization structured?
Yeah, we have a board of directors and the 8 members, and each of them represent a sub-region on Africa. So we have a board member from Mali for West Africa, another one who is from Kenya for East Africa, etc. And we have a secretariat based here in Johannesburg. And when the Pan-African Business Coalition was launched, it was supported by the Standard Bank Africa. It is still supported by the Standard Bank Africa. And it was launched also by Standard Bank Africa and GIZ and the GBC, the Global Business Coalition, but we are mainly supported by the Standard Bank Africa.
All right, that is a good point. You're also involved a lot in policy formulation, in trying to get companies and I believe even governments to put in policies to deal with people living with HIV/AIDS because they're every part of life now.
Yes, it's very important. You know that the companies are developing HIV/AIDS programs, but also policies. And
right.
for policies includes the 10 principles of the ILO Code of Conduct, including discrimination, stigmatization, confidentiality, gender issues. And it's very important for us, for the company, to develop such policy. And as you know, the ILO has a new recommendation issued in 2000, adopted by the international community in 2010. And now with that recommendation, it enforces the duty of the companies to implement, to have HIV/AIDS policy and program in the workplace. So this is very important for us. We are now in the process of developing partnerships with some regional bodies, because
Right.
it's important for us to drive ideas from the regional, from the global level, regional level, to the NBCs and the field, and from the field to the top. That's why we have approached some regional bodies and governmental organizations particularly to try and partner with them. We are in that process.
You talked about stigma. Is this still a big deal in the continent? Stigma just against people living with HIV/AIDS and a lot of misinformation regarding this? Is it still a challenge for you?
It's still a challenge, but in the workplace there is a big improvement.
Right.
Big improvement, but because people are not dismissed now because of their HIV status. This is very important. It has improved.
And is that because there are laws against this discrimination, or is it because the general population and not just employers are beginning to understand that having HIV/AIDS is not, let's say, a death sentence?
Exactly, because people are experiencing the disease, they are affected. If they're not infected, they are affected by the diseases. So they experience the diseases, and they also, because also of the laws, because the policy in the workplace provides some rights to the people living with HIV.
What is the greatest challenge right now in your work?
Our challenge, the greatest challenge, is to continue to mobilize the private sector, because the private sector is doing a good work, is really complementing the work done by the government. But in some countries, there are still a lot of companies who don't have HIV policy and
Right.
programs, so we have to improve that. As I said it before, we also want to integrate TB control in the workplace programs and the prevention of mother-to-child transmission of HIV. This is for us a challenge. Another challenge is to reach the national enterprises, because the multinationals are aware of the problem.
Right.
But we need the national companies, particularly the medium-sized enterprises, to get more involved in this battle. And we have a tool, the Biz Health tool. We use, you have certainly heard about it.
Right.
It's a training approach, but provides business skills to the participant of a training. And it improves also their information and education regarding HIV, tuberculosis, and malaria. So we are using that to have a direct access to the community, and particularly to the owners of small and minor-sized enterprises. And another thing with that, the BizAce tool was very well known in
Right.
South Africa, but now we have the Pan-African Business Coalition is sharing the tool with other countries, and we are currently implementing that in Nigeria, Kenya, Zambia, and so Nigeria, it's West Africa,
Kenya
and
and
with
East
the
Africa,
support
right.
of the Standard Bank Africa. And we have added something to that. We now give the opportunity to the participant to have access to the knowledge and information regarding financial services, so that they can improve their income. We are putting together healthy people and healthy business.